Aurora Health working with us, as well as Aurora Baycare Medical Center, Bellin Health Systems, Prevea Health, HSHS, St. Vincent, and St. Mary's Hospitals. Last week, we had some healthcare frontline workers join us to talk about what they're seeing, hearing, and doing. This week's Faces of COVID briefing will feature some patients and families who will talk about the very real personal impacts of COVID-19. Before we go to our first speaker, I'd like to provide you with a brief overview of the current status of COVID-19 in Brown County. Today, we have 13,140 positive cases in Brown County. That's an increase of 202 from yesterday. We have 81 deaths. Out of isolation, we have 9,066 people, which is an increase of 390. As always, you can find an updated daily dashboard online on our website at www.stayhealthybc.com. You can also check the Wisconsin Department of Health Services website for current information. By now, many of you know someone who has had COVID. I think one of the most striking things about this virus is that there are so many different ways it impacts those who get it. Today, you'll hear from people of varying ages from several locations in Northeast Wisconsin about what it was like for them or their family member to have COVID-19. These are personal stories, and we greatly appreciate their willingness to share. Each story is different, and I think they will present a very real picture of what is happening in our community. We're going to start with someone who contracted COVID-19 early in this pandemic at a time when not much was known about what was happening or why. Steve Meyer is known by many people in our community. He's a business owner and the Chief Strategy Officer at the Karma Group. As a community leader and volunteer, he co-founded Streetlights Outreach and Whatsoever You Do Incorporated. He is also a deacon serving in the Diocese of Green Bay, a public speaker, author, and a married father of 3. Steve, thank you for joining us today.
Thank you, Claire. When the news of COVID started building in early March, I was probably on the hyper responsibility train. I understand exponential growth. I wholeheartedly believed that I had a responsibility to the people that I work with at my company, my family at home, and all the communities that I participate in. So while I didn't like the idea of social distancing, it's really a hard thing for me personally. I did it anyway from the very beginning because I decided that's what love does right now. That's how we show that we care for other people. When someone from the health department who was doing contact tracing called to tell my wife that she was on the short list of people who had been directly exposed where she was working, I was worried about her, not about me. But then I got sick, and she got sick as well, but her symptoms did not get as severe as mine. My initial experience with COVID was a little devious. It felt like the flu, a sore throat, dry cough, fever, fatigue, all that stuff that we've been there, done that. So I figured I knew what to do, rest in fluids, right? After a few days, the fever broke and I declared myself healed. In fact, I denied it was even COVID in the first place, insisting it was actually just a flu. I got into an argument with my son, who is a physician working with COVID patients at the University of Nebraska Medical Center, but I dismissed him because he's just a kid. What does he know, right? But 2 days later, it roared back, and I got really sick. I got sick in ways I had never been sick before, with chronic night sweats, complete loss of all taste and smell, which made eating very difficult, and the most unbelievable fatigue. I'd need to sit down after walking just a few steps. By the next day, breathing had become difficult. I just couldn't get enough air into my lungs. For me, it wasn't painful like it is with pneumonia. It was just labored, like when I've been backpacking at 12,000 feet without being acclimated. And that was scary. So the two things that I remember most about the experience with COVID last spring were first the fear I saw on the faces and in the voices of my family, friends, coworkers, and the fear I felt within myself when I struggled to breathe. And secondly, the persistent brain fog. I just couldn't focus or think clearly for several weeks. Here's what I really want people to know. I got really sick and I don't have any other risk factors. I'm under 60. I have no heart disease or asthma. I don't smoke. I'm not overweight. You do not want to get COVID, and you certainly don't want to be responsible for giving it to anyone else. So when I'm seeing social media posts about people refusing to let fear win, it troubles my soul. In wearing masks in public, avoiding crowds, keeping distance, none of that is about fear. It's what human compassion does right now. This is how we care about the well-being of other people. So thank you, Claire. I'll turn it back to you.
Thank you so much for sharing, Steve. We're really grateful that you could join us and share your story today. Joining us next, I believe, is Jennifer Webster. She was having some audio and visual technical difficulties, but Jennifer, can you hear me?
Yes, I can. Can you hear me?
Yes, I can hear you. So Jenny is a member of Oneida Nation. She's a council member, and she also has very personal experience with COVID-19. Jenny lost her father earlier this year to the virus. She's going to share what it was like for her and her family as they dealt with their father's illness and his eventual passing.
Good morning. Thank you, Claire. I had to move from my laptop to my phone, so sorry if it's a little bit uneven here. So my name is Jenny Webster. I'm an Oneida tribal member and also elected government official to our Oneida Business Committee, and I'd like to share my story with you. My story starts back in May, so this was early on in the pandemic. My father, Lee Gordon McGuster. Oh, tap to mute. Something happened here. Up.
We can still hear you, Jenny, if you want to keep talking.
Okay. Trying to fix my phone here. Hope I'm back on. Okay. So my story starts back in May. So this was early on in the pandemic. My father, Lee Gordon McGuster, was 80 years old. He had heart disease and was blind from diabetes for the past 2 years. He was a tribal historian and had published several books on the history of the Oneidas. And he had most recently published his book in October, and he was working on another book. He was taken to the hospital on Tuesday, May 19th. So of course, we all rushed down to the hospital, but we can't go in. It wasn't safe for us to be at his bedside. All we could do was sit down and wait in our cars at the hospital. And I think it was after the initial shock, you're sitting in your car, you're looking around, and there's all these other people sitting in their cars. And you're hurting, you know they're hurting, and we all know nobody can be at our loved one's bedsides. And it was just so hard to see that sorrow in everybody's eyes. And there's nothing you can do but sit and wait. And finally the nurse called and said that it would be better for us to wait at home, and that my father had tested positive for COVID-19. So we did. We went home. Prior to going home, me and my sister and my mother went down to the Rush Center. They had just opened up the drive-through, so we had gone down to the Rush Center to get tested. Me and my sister tested negative. My mother tested positive. She's a 4-time cancer survivor, so we were really worried about her. However, her only symptoms were a shallow cough. While my father was in the hospital, That's all he wanted to do was come home. He would, the nurses would allow him to call, and every time that's all he said was he wanted to come home. They finally took the phone away when he had called 911 on the doctors on the hospital because they wouldn't let him go home. So that's just typical of my father, doing his best to try and get home. My father then passed the following week, May 26th, the day after Memorial Day. And I can't tell you how hard it is to grieve, knowing that you can't console your loved ones with a hug. We're hugging people, and our Oneida families are so close. We had to be so cautious. We did a drive-through funeral in the parking lot because we couldn't put ourselves or anybody else at risk. We felt that was the safest way to be able to receive family and friends to pay their respects. The nursing home where my grandmother lives was kind enough to bring her to the funeral service in a van, but they had rules: nobody in, nobody out. She couldn't leave the van, and nobody could go in and sit with her. It was like they brought her right up to the front. It was like she had her own little Hope-mobile. But she's 97, so she can do that. My mother's doing well now. She's fully recovered. They had been married for over 50 years, so she's adjusting to being without my father, changing all the bills over to her name. One of the issues is changing everything has passwords on his computer, on his phone, is trying to change those passwords over to her name. So that's been a little bit of an issue. So with Native people, we have a higher risk of getting COVID-19 because of the health disparities with heart disease and diabetes. And so we have to do all that we can to protect our children and our elders. So I want you to know, if you take anything away from this, I'm pleading with you to wear your mask. If not for yourself, to please wear your mask to protect those that you love. Thank you for listening and letting me share my story. And please remember to wear a mask. Thank you.
Thank you so much, Jenny. We're so sorry to hear about the loss of your father, and we thank you for being willing to share such a personal story with us. One thing I think that we've all learned throughout this pandemic is that this virus impacts people of all ages. Dan Unright was 32 years old and a personal trainer. He was and is still in great shape when he found himself COVID-19 positive, and he was eventually hospitalized for 10 days. His wife, Lindsay, happens to be an ER nurse, and both of them are joining us today to offer a unique perspective of having seen COVID-19 in several different ways. Lindsay will share how she had to quarantine herself and her 2 young daughters while Dan was isolated. Fortunately, no one else in their family came down with the virus, but it still impacted each and every one of them. Thank you, Dan and Lindsay, for joining us today.
Thank you, Claire, and good morning to everybody. Being healthy and really having no underlying conditions, I began to feel sick, and it was flu-like, and I had fever, ache, and chills. I went to get tested, and I eventually tested positive. At that moment, I convinced myself that I was going to have a mild case of COVID since I was young and healthy and had no underlying conditions. So I was quarantined to my room, and because of my belief, I ignored my initial chest pain that I started to have, and it got worse. And then we realized that my oxygen began to drop, and that's when I went to the hospital away from my family. I learned that I had pneumonia, and I spent 5 of 10 days in the ICU while I received oxygen up to 35 liters, and I was sleeping with a CPAP every night. With my oxygen continuing to drop and my uncertainty was increasing, I was told by the doctors that intubation was the next step. I thank God I started to get better before that, and I was able to go home after 10 long days. And it's been 2 months now since I had COVID, and I'm still trying to get back to my normal lifestyle. The hardest part about this experience was just not knowing when or if I would return home to my family. So I'd just like to encourage everyone to just respect the health officials' advice as they're trying to do the best they can, and just try to do the small things that they're asking, and that we can stop the fast spread of COVID and keep the hospitals from being overwhelmed.
COVID had been affecting me professionally for the last 6 months as an emergency room nurse. I'd seen it every day, but I never imagined that it would be my family, and I never imagined the toll that it would take on my family. When Dan found out that he was positive, I just assumed that since he is young and healthy and eats right and exercises every day, that he would have a mild case. But our world was thrown upside down when he was hospitalized. I felt so completely helpless when he was getting worse every single day in the hospital, and I wasn't able to be there with him. And I felt so isolated at home with my 2 small children. They're 3 and 5. We were completely physically cut off from our support system. So we had to go through all the stress and anxiety and pain by ourselves. We thank God that Dan was able to recover, but we're still feeling the effects of COVID months later, physically, emotionally, and financially. It's really taken a huge toll on our family. I know everybody is tired of COVID, but we beg you to continue to take this seriously. The lives of our family members and our friends and our community really depends on it. We ask that people avoid large gatherings, wash your hands, stay home, even when you're mildly sick, because sometimes the symptoms start mild and then they progress. So even when you're not feeling 100%, stay home. Wear your mask in public, and follow the guidelines of the quarantine and isolation. We all have to work together as a community to decrease the spread of COVID-19. Thanks, Claire.
Thank you so much for sharing your stories with us. I think their story really shows how the patient and the family are all impacted by COVID-19. Joining us next is Audrey Nowak. She's a 53-year-old orchestra teacher at Bayport High School and a local musician. Audrey recently battled COVID-19 just last month and is thankful to be here today to share her story and the impact that COVID has had on her life. Audrey?
Hi, Claire. Thank you. I'll start by saying probably the most common question I'm asked is about the symptoms, and I know it can be really confusing to know if you're dealing with COVID or allergies or anything like that, and I'm certainly not a doctor, but I urge caution for everyone because my symptoms at first were very mild. They came out of nowhere, at the end of a day, I just developed a cough and a really bad headache. I'm not prone to headaches, and it worried me enough that I called the COVID hotline where I work, and they suggested I get tested. So I went to get tested, and it took a few days. By the time I got the test back, I was pretty sure it was positive because I got tested on a Friday and it came back Sunday. And by Sunday, I had fever, chills, no taste, no smell, like the others described. I mean, I was sicker than I have really ever been. And I kept telling myself not to worry. I'm young, all the things you hear, and but it's COVID, and of course you're not going to feel well. And thankfully for me, a friend of mine had sent me a pulse oximeter because COVID plays with your mind, and you don't always know what's happening. And I knew I needed to be eating and drinking, but I literally by Monday and Tuesday was so weak and so tired. I couldn't force myself to drink, and I was just getting so sick. But on Wednesday, the pulse oximeter showed me that my oxygen was actually quite low. So I went to the ER. Really, expecting to maybe receive some fluids and go home. So I was very surprised and scared when I was admitted to the ICU at that point. There's nothing like hearing those words. I think a lot of the closest analogy I can come up with is if you get in a car accident and people say your life flashes before your eyes, everyone understands that and it happens just for a second. But if you're in the ICU with COVID alone, isolated, cut off from all of your family and friends, your life flashes before your eyes minute after minute, hour after hour, day after day. And there's like no end. And you don't know what's going to happen. And it's really scary. And I really want to thank the doctors and nurses because the sacrifices that I've seen them make have been incredible, because I know that they're probably scared and lonely too, but they don't have an option and they come to work. And I was at Aurora Baycare and, they have to put the whole PPE on before they come in. And at first I joked to some friends, they look like Martians and, you're all isolated, but it doesn't take long to feel the warmth and compassion that comes from those healthcare providers. And they always took a little time to visit in my room, and I'm just so grateful to them. But you're also laying there alone, and I didn't have the strength or breath or energy to talk to my family. 2 of my children got COVID at the same time, and they were home isolating, and I was so worried about, them, and thankfully they were fine, but that was just one more thing to worry about in the hospital. So anyway, that's just a very scary experience, and thankfully I received lots of Facebook messages and things like that, so I want everyone to know that really does help, because when you're too tired to talk, it was something I could read and kind of feel uplifted, by that. So I guess I want people to know that you don't know how COVID will affect you, and you really do not want it. I would have never imagined to have the kind of effects that I have. It's only been, I think I've been home for 3 weeks. I'm still, I'm much better, but the fatigue is unbelievable, and it hits out of nowhere. And that's still a problem. The financial effects are a problem. I mean, and not just for people who got COVID, but for the whole community, and musicians, nonprofits. I have to say that because I'm a musician. I haven't been able to play a gig since March. It's really, really difficult. So please understand, I guess, our whole community. I mean, it breaks my heart to see where we are. And I just want everyone to respect the healthcare workers and to know that they don't have the luxury of forgetting about COVID for a little while or just one weekend. They're working nonstop, round the clock, missing their families, in some cases isolating from their families to protect them. It's not an option for them. And it just really hurts my heart to think of people not being careful and or not understanding the need to be careful. So I just encourage, like everyone else, please take this seriously, and maybe we can get these numbers under control before Christmas, and wouldn't that be a gift for everyone? So anyway, thank you, Claire. And Jenny, I wanted to say I'm really sorry for the loss of your father.
Thank you so much for sharing, Audrey. We really appreciate you sharing your story. And thank you to all of our guests today for taking the time out of their busy schedules to come in and join us. What strikes me about all of these stories is the toll it's taken on them, not only personally, but kind of like Audrey was mentioning, on their families and friends and our community as a whole. This is why we are so passionate about reminding people that the actions they take today, such as masking, physically distancing, washing your hands, avoiding large gatherings, makes a difference in what will happen tomorrow and in the future. This also includes knowing what you should do if you test positive for COVID-19 or if you've been exposed to someone who is positive for COVID-19. So I'm going to share a few graphs here or PDFs that you can find online at Wisconsin Department of Health Services website that demonstrate what you should do if you are a close contact of somebody who has been diagnosed with COVID-19. So this first one would be for if you live with someone who is diagnosed with COVID-19. This is a handy PDF that you could print out. And again, Nathaniel will share the link in the chat. I can also help navigate you to the page if you'd like to share with friends or family or partners that you work with. This is a great graph to reference. And I know there's a lot of information floating around out there on social media, web pages, and things like that. But this is what Brown County Public Health would recommend that you reference to. Again, this is put out by the Wisconsin Department of Health Services. And then the second PDF that we'll share with you today is if you have had close contact with somebody that you work with. So let's say you are maybe a waitress or a bartender, or you work in an office and you've learned that they have tested positive for COVID-19. This would be what we would recommend that you follow if somebody in the workplace or someone not in your immediate household is diagnosed as positive and you are determined as a close contact of that person. Close contact, remember, being you spent more than 15 minutes in an enclosed space with them. Maybe you were around them when they sneezed or something like that. Maybe they weren't wearing a mask, things like that. So again, Nathaniel, put that link in the chat if that's something you're interested in sharing. And there's lots of good information on the Wisconsin Department of Health Services website. There's lots of good information on stayhealthybc.com and the CDC website as well. Before we go to Q&A, I just wanted to let everyone know that our next media briefing will be on Wednesday at 11 a.m. Behavioral and mental health, looking at not just at the toll this is taking on people, but providing some helpful information about dealing with the very real stress that has been occurring. We're going to look at impacts on children, families, marriages, businesses, and employees, as well as discuss the COVID-19 fatigue in our community. With that, we will open it up for questions. As always, if you could please state your name and the media outlet that you're reporting from and who the question is directed towards.
Hi, Claire. Rob Sussman, WTAQ. If this question is for you, Pfizer, I know, is looking to start pumping out a COVID-19 vaccine here in the very near future, according to the Wall Street Journal. My question is, has the Brown County Health Department set up a avenue with which to distribute a vaccine when it becomes available? Thank you.
Hi, Rob. That's a good question. We would probably mirror what our flu clinics would look like. We're currently offering a drive-through flu clinic that will, pending weather, hopefully go live tomorrow. So I would say we would mirror what a flu clinic would look like and translate that over to a COVID-19 vaccine clinic.
Immediate follow-up to that, as I know we've had issues with the flu vaccine and its availability. Is there any hope that that's going to get better here in the near future?
We hope so. Unfortunately, what DHS is telling us is that it has been delayed and it could arrive anytime between November and January. So we will prepare ourselves for that. Any other questions for any of us today? All right, well, thank you everyone for joining, and we will see you next week at this time. Have a great day.